Welcome, guys. So, today on this episode, we're going to be talking about Viagra and Cialis used for ED, erectile dysfunction. So, erectile dysfunction has become a very common thing now. Um, it's not just happening to older men, it's happening to anyone of all ages, of in any men. And it is something that, we do need to talk about it and talk about the different drugs that you can use for it as well. It's nothing to be ashamed of. All the stigma about it, please, let's ignore that. Let's get into the grittiness of it. Let's talk about what you can take to help you, okay? So today we'll talk about how you could take Viagra, the side effects of it, who could take it, and anything that will be beneficial to anyone listening, to be honest. And also talk about the myths again about it. And any questions that you have for us, please send it our way. So let's start off by talking about Viagra. What is the drug in Viagra and how does it work and how does it help with ED?
So to start with, there is Viagra, which you can get on prescription, and then there is Viagra Connect, which has been available to buy over the counter in the UK for sort of the last 2 years. And this is, of course, to help men who are suffering from erectile dysfunction or any erectile problems. So the drug in Viagra is sildenafil. And this is in both the over-the-counter medication and the Viagra that you will get if you get a prescription for Viagra. And there is a Cialis, which is, again, very recently, it has been made, basically it's been made over-the-counter medication. So you can actually get Cialis in the UK over the counter. I think only one of the pharmacies do this now. But of course, the other pharmacies will catch up. But I think for the last sort of 6 months, Cialis has been available to buy over the counter in Boots Pharmacy. And the drug in Cialis is tadalafil. Now, again, with both sort of generic versions and branded versions of both of these drugs, you can get them both on prescription, and now, very recently, you can actually get them over the counter.
With the Viagra, we do have like different indications for it. The drug itself, like, the sildenafil. So with the over-the-counter one, is it just the Viagra that you can buy? Because I know with sildenafil it has different indications. There are some people that use it for ED. There's some people that use it to treat something else like pulmonary hypertension. So which ones are available over the counter? Could you also get the other one
So over the
over the
counter in the
counter?
UK, I think only Viagra Connect is available. So over the counter in the UK, you can't just get the Viagra Connect, which is the only branded item available to buy over the UK in the UK over the counter in the UK. Now, I know some pharmacies are doing their own version of it. When I say version, the own brand of the Viagra or the sildenafil, basically. And Boots have got, I think, a couple of their own brand. They've got their own generic as well, which you can buy over the counter. So it will basically just say sildenafil. Whereas with
Okay.
Cialis, you can it's currently, because I'm not sure what other pharmacies are able to basically sell Cialis over the counter, but I know for sure that Boots Pharmacy, for instance, sells it, but it is just the branded version of it, which is Cialis.
Okay. So, I want to talk about how these medication work. Like, how does it actually help with erectile dysfunction? Um, so as many people know, erectile dysfunction, it can be caused by many things. So it could be due to, maybe some sort of disease you have. It could
Yeah.
be maybe a diabetic problem. It could be just like blood flow to your penis, not enough. It could be due to drugs related. So many
Hmm.
things can cause like function. So how does these drugs actually work? Um, Judy, do you mind just telling us about it?
Right. So I think with both sort of the tadalafil and sildenafil, regardless of whether you're getting the branded one, the branded version that you can buy over the counter in the UK, or even what you get on a prescription, they very simply just work by allowing blood vessels to relax and expand within the body. Therefore, this causes blood to flow to the penis. And of course, this results in an erection that's hard enough for sexual intercourse, because we're aware that erectile dysfunction is mainly, it could be basically classed as either you're not maintaining an erection, or you're not able to maintain an erection for sexual intercourse, or you're not able to actually have an erection. But of course, what it does is both of these drugs, what they will do is they will allow blood to circulate to flow to the penis, and of course, when there's blood flow, there will be that sort of like contraction and expansion, and of course that will result in erection. So that is the simplest way to explain how Viagra and Cialis work, basically.
Mm, okay, okay, brilliant. Fantastic. Um, how would one take it? Like, um, what are the special requirements? When should you take it? Do you need to take it maybe just before you have sex, or do you need to take it way before you actually have sex?
Yeah. So with for most men, so 15 milligrams of Viagra is what is recommended, and this is normally usually basically this should be effective enough to give you an erection. Now you should take Viagra Connect or Cialis an hour before intercourse, preferably on an empty stomach, and it's also best not to drink a lot of alcohol, even grapefruit juice, before taking the medication, because this actually has an interaction with the medication. So it will have a negative interaction, whereas you might actually not get the effect of the drug. So normally an hour up to half an hour before intercourse, you can take the drug and it should be effective.
Yeah,
And the effects can actually last up to 4 hours.
yeah, yeah. I was just about to ask that because I know with the sildenafil it lasts up to 4 hours, but
Mm-hmm.
I think with Cialis, it lasts a bit longer, isn't it?
Yes.
It lasts like 36 hours.
36. It
Right.
can
Yeah,
last
I
up to
read
36
that.
hours.
Yeah, and I think
Yes.
that's pretty long. Like,
That's good though,
so
yeah?
yeah, for a man that, you may take him maybe on a day,
Mm-hmm.
and then the next day maybe you may want to continue on the action. I think that would
Yes.
work for you. Yeah. Is there are restrictions as to how many a person can take these drugs? So let's say, for instance, someone takes maybe on this day, and then the next day they want to take another one. Is that okay, or is there any restrictions to it?
So in regards to say Viagra, you should take basically one tablet a day, right? It may not be safe
Mm,
if you have, say, some conditions, to take more than one a day. To
mm,
take more than, well, I suppose two in a row, anything like that, because of course that can actually affect some of these conditions. But one thing for sure is you should only take it one a day. But of course, if you've had that conversation with, say, your pharmacist, your doctor, and everything is okay, you can't take more than basically you can take one every day if needed, but you
okay.
cannot take more than one of Viagra or
Mm,
Cialis. You cannot take more than one tablet a day. So if, say, you've taken one and you're thinking, wait, this is not quite doing it. It is not recommended to take another tablet during that 24 hours.
Yes. Yeah. Okay, fantastic. So, there's a lot of stigma when it comes to erectile dysfunction. Let's put it that way.
Yeah.
Even for like a young man to come to a pharmacy and say, I have ED, do you have something for me? Like they find it embarrassing
Mm-hmm.
to actually talk about it. And I
Yeah.
think it's something that, people need to be familiar with.
Yeah.
So when it comes to Viagra and Cialis, is there anyone that cannot have it? Like who can take it? Because all these young men think that, they can't get easy. So,
Yeah.
maybe they can't have the medication. But
Yeah.
is there who are these for these medications?
If you, of course, suffer from erectile dysfunction, this might be a medication for you, but there is some restrictions
Hmm.
as to who can take it and who cannot take it. Now, if you are under 18 years old, it is not recommended for you. So, especially if you're buying it over the counter, you cannot just buy it over the counter if you're under 18. And I will not basically suggest even lying about your age just so you can get it, because it is not because
Yeah.
that's what happens in pharmacies, and we see that all the time. You get a lot of young boys come in and they lie about a lot of the questions as well, but you can sort of read through it and you know that this is not a medication that's suitable for them, but maybe they want it for trial purposes, maybe they actually need it, but they just very embarrassed to even go to their doctors and have that conversation, because of course that might include maybe that might somehow get to their parents, so they come to the pharmacy to try and get it that way, which is not actually suitable because it might not necessarily be suitable for you. So if you're
Yeah.
under 18, don't just go to the chemist and buy the medication, because it is not suitable for anyone under 18 over the counter, because there is a lot of tests that need to be carried out before getting being able to buy it over the counter. So if you feel like you have, say, erectile dysfunction and you're under 18 and you want to maybe seek ways to sort of sort that out, best thing would be to go to your doctor, speak to your doctor, maybe get some tests done, and then, if need be, you might be put on medication for that. Now, there's certain groups of people that this medication might not be suitable to. So if you have a history or even a family history of, say, eye problems or any side issues, this might not necessarily be a medication that's suitable for you. So it might be worth just having that conversation about, okay, maybe I need to be referred, maybe, again, tests always need to be done in these kind of cases. Anyone sort of with a history of kidney and liver problems, sickle cell anemia, and multiple leukemia, things like that, this might not be a medication that's suitable for you. Also, if you have, say, low blood pressure, this is not a medication that is suitable for you, because one thing for sure is that in regards to, say, sildenafil, it actually has been used for hypertension. So it lowers blood pressure. So if you have a low blood pressure, you're at risk of a very low blood pressure, which can actually be quite tragic. So if you suffer from low blood pressure, be honest about this whilst you're going through the consultation, because this might not be a suitable medication for you. And also people with certain medical conditions, certain heart conditions, cardiovascular conditions, this might not be a medication that's suitable for you. So one of the things we normally ask in pharmacy is, are you taking any, nitrates or anything like that? Because this can actually interact with the medication quite badly. So if you're on some of these medications, be honest about some of these conditions, be honest about the medications you're taking, as well as also just be honest about the conditions that you have, just so you get the correct medication and the correct consultation as well. So if you have any conditions that you think, okay, there's already so many restrictions as to what you can and cannot have, then it would be worth just sort of mentioning that, because there is a lot of things that can actually interact with medication, and a lot of conditions can interact with Viagra and might not be suitable for people who are, are having some of these conditions to be
Mm.
on Viagra.
Okay, fantastic. So by the way you've explained things, or with the way sildenafil and Cialis work, I think it kind of makes me wonder what kind of side effects would one expect. I can guess some of them, like dizziness and headaches, that sort of thing. But
Yeah.
what else would one feel, or would one get if they do take Viagra?
Okay, so because of course, as you said, Steph, with with what we know about sort of like any medication that might lower blood
Yeah.
pressure, you might get some of these side effects. So it's actually very very similar with sildenafil and tadalafil. So that is Viagra and Cialis, where you might get side effects like headache, facial flushing, nausea, congestion, dizziness, indigestion, things like blurred vision. Hence why, if you have any sight problems, this might not be the medication for you. So things like that are very common with
Mm.
Viagra Connect, Viagra, and also Cialis. But again,
Mm.
some people don't even have one of these side effects. Again, we always say side effects are things that could
Yeah.
potentially happen, not necessarily things that will happen.
Fantastic. This was very informative. So I want to move on to like some myths, because I've heard like some few myths about like erectile dysfunction and
Hmm.
and with Viagra, so many things. So one thing, I think one myth I heard with Viagra, some people say Viagra increases their sex drive, but how true is that? Because I don't think that would increase your sex drive if something, it just increases like the blood flow to your penis. Like, how true is that? Because I hear a lot of conversations saying, yeah, it's gonna increase my sex drive.
You know what? I'm glad you said that, because what happens is a lot of people come
Yeah,
to pharmacy and basically they want to get it as I don't know,
yeah,
to sort of like, to make it, a little better, to make it last longer, or
yeah,
to, do you know what I mean? Like, no, none of that is actually going to happen. And I've had a lot of people where
yeah,
literally as soon as you start answering the questions, I'm reading through it and I'm like, you don't even need
yeah,
this medication. Or one of the questions we ask is, do you suffer from erectile dysfunction? They're like, not sure or no. And then you have the conversation, they're like, I actually just want to try, just want to see if it's going to make much of a difference, kind of thing. So you clearly don't suffer
yeah,
from erectile dysfunction. But basically,
definitely.
if you're not sexually aroused, or if you don't need the medication for erectile dysfunction, the medication will actually not have any effect on your body. So you won't basically get any bigger erection than what is normal, right? So if you take
Mm,
Viagra or Cialis and you don't actually need it, it's not going to make any bigger difference in terms of like you will not last 10 hours, or I don't know,
mm,
15 hours, or I don't know, things might be bigger than usual, or
yeah,
wider than usual. That's not going to be the case. But what could actually happen is you will actually potentially get some of the side effects. So the active
mm,
ingredient will still remain in the system for 4 hours, in which time you could still be undergoing some of the side effects that are associated with both sildenafil and tadalafil, but nothing is going to change in regards to, say, how aroused you are, or how big an erection you get. It will all still
yeah,
stay the same. So it's not going to make any bigger difference to someone who is not who doesn't suffer from erectile dysfunction.
yeah, yeah. I'm so glad you said that, because, like, some people feel like if they're not sexually aroused and
Hmm.
they take Viagra, they're probably gonna get erected. But really, as Trudy said, if you're not sexually aroused, this medication is also not gonna work. It works like hand in hand. You have
Yeah,
to be sexually aroused
yeah.
for the medication to work. So you can't just take it for the sake of taking it just because you're not. attracted or to someone or you're not aroused. So please
Yeah.
make sure that you know you are aroused first before you take it.
Yeah.
Otherwise, it's just a waste of time. Yeah.
And money.
And money, yes,
And money, because
true.
it is not cheap. Viagra, whether you're buying it over the counter, I know in UK, like there's
Yeah,
a lot of people get on private prescription and it is
yeah,
really not cheap. So if you want to waste your money, go for it.
yeah,
But I will not really, I will not recommend it if you don't
yeah.
need it, of course.
That's right. Speaking of like the prescriptions, actually, I think with NHS, they only give it to a special group of people, especially like diabetics,
Yeah.
and even with that, it's restricted.
Hmm.
They only get about 4 tablets a month.
Yeah.
So yeah, there's a lot of restrictions. We do hear like a lot of myths about these drugs and the way they work. You know, with every drug, there are people that make speculations about it
Hmm.
and they try to deter people from using it.
Yeah.
People come up with like awful things saying, "Oh, this drug is not good for you. It's
Hmm.
dangerous. It can do." But one thing that also I also heard about these medications is that some people say it can affect fertility in both men and women. How true is this, truly?
I haven't read any research paper or I've done any research or read anywhere that this
Yeah,
is the case. So this is definitely not the case. I mean, there is a lot of
yeah,
myths going out there. There is no
yeah.
way that it will affect fertility.
Mhm.
Because I mean, with the way it works, it's literally just helping blood flow to the penis. It's not messing with any, with anything else. So this is unfortunately not really true. It shouldn't really, with what we know about Viagra Connect, as well as Cialis, as well as Viagra, both generic and the branded, it is not known to cause any fertility issues. So don't listen to all these myths. Don't read too much on this. There is a lot, honestly, there is a lot that is said out there, but this
Yeah,
is certainly not true.
yeah, yeah. You know, there are so many like bizarre things on the internet. So
Yes.
people come to you, you know, to the pharmacy to ask these things, and we have to be prepared for it. You know,
Yeah.
we have to give information. Um, yeah. So another thing that sometimes I get asked, can women take these medication?
Do you know what? You know, I shouldn't even. This is. I've actually had a woman come into pharmacy with a friend, and we were like, "We cannot sell it. Who needs it? Is it your partner?" She's like, "No, it's me. It's for me." And we're like, "I'm
Yeah,
sorry, but we cannot actually sell this to you. It is not
yeah,
recommended and it's not suitable for women." But her friend was even like joining in, like, "Give my friend, give her what she wants." And we're thinking, first of all,
yeah,
you could try this medication. It's not going to do nothing for you because it
mm,
is, first of all, Viagra Connect or Viagra, whether you gain it off the counter or on prescription, is not actually
yeah.
suitable for women to take, because as
That's
we
right.
said, it works by increasing blood flow to the penis, and
Yeah,
unless that is the situation with you, it's not going to work. So it doesn't actually increase blood flow to, say, female genitals, and I suppose that's what's crucial for sexual experience.
yeah,
But so it is not going to actually help you with what you think is going to help you with. It is not suitable for women. So
yeah,
stop this, women. Viagra is not for us. It's
yeah.
not for women, it is for men. It is only suitable for men because of the way it works. It can only work for men.
That's right. That's
Mhm.
right. Evidence have been laid. Okay?
Yes.
So there's no evidence that these medication work for women for sexual problems.
No.
Okay? If you're using it for a different indication, let's say pulmonary hypertension, yes, but
Yes.
not for sexual problems.
Yeah.
Okay?
Hmm.
That makes me move on to, does it affect contraception? Because some people do ask them, like, what if like their partners take the Viagra and sildenafil? Will that affect their contraception in any way?
It doesn't. it doesn't affect contraception. And I don't actually see how that is possible, but there is a lot of myths and talks out there.
Yeah.
But with these two drugs working so differently, there is no way that one will counteract the other. So
Yeah.
tadalafil, sildenafil will definitely not counteract your combined hormonal contraception, your progesterone, it will not interact. So it will not affect your contraception.
Yeah.
But do you know what, though? I am glad people are asking these things, because we want people to be as safe as possible when taking medication. So if you have some questions about, okay, I'm on this drug, my partner is on this drug, are we on the same level here? Are we on the same, I'd rather people ask us these questions. And also, to be honest, there is a lot online. Like if you Google anything, you will literally be going down a rabbit hole. Like there is so much out there. So it is worth asking some of these questions. So I appreciate it, but it is just a myth. No, this is not the case, I'm afraid.
Yeah.
Fantastic.
This has been really good. I love that. It's good to share these knowledge to some of our men and women out there. Speaking of the topic of erectile dysfunction, so we've spoken about the medications we can do, but let's say for instance someone just wants to improve themselves, just to see if they can help with the erectile dysfunction. What kind of advice would you give them? What sort of lifestyle changes can they make to help improve their erectile dysfunction?
To be very honest, a lot of lifestyle modification actually helps with a lot of health conditions, and erectile dysfunction is one of those as well. So a lot of people who suffer from erectile dysfunction might find that maybe they're obese, or they smoke, or basically they live a life that could need modification. So if you're obese, losing some weight can actually help with erectile dysfunction, and this has actually been proven by science. This studies that's been done out there. Smoking as well. Unfortunately, if you're a smoker, you're potentially going to suffer from erectile dysfunction. So if you stop smoking, you might notice that this actually helps with solving some of these problems. Now, unfortunately, this is good, but again, it's just what it is. But people who cycle might find that they actually suffer from erectile dysfunction. I'm not saying don't cycle, exercise, guys. Get out there, get your bikes in the summer, get cycling. But just so you're aware that cycling too much can actually cause erectile dysfunction. So maybe be wary. If you're very big on cycling, maybe just get that checked every year just to make sure everything is okay. And if you notice that maybe you're suffering from some of these conditions, like erectile dysfunction, it might be worth maybe just toning that down slightly. Now, again, if you drink too much alcohol, that could actually also cause erectile dysfunction. So it might be worth cutting down on how much alcohol you drink in a week. We know that, we're recommended a certain amount of units in a week. So if you're going past that number of units, then maybe it's time to sort of just look into that and maybe tone it down slightly, because again, drinking too much has been known to cause erectile dysfunction. Now, again, stress is a trigger for erectile dysfunction. We live a life of stress. So this is going to be difficult to try and sort of stress less, but honestly, we need to stress less, because stress is a cause for a lot of things. Erectile dysfunction is one of them, but there's a number of things that stress can actually worsen, if anything. So if you find that you're constantly stressing, or if you find that you're constantly in stressful situations, it might be worth sort of looking into that and seeing how you can work around that, because that could also be the reason why you have erectile dysfunction. And of course, there is certain medications that can affect, that can cause erectile
Yeah.
dysfunction. So having these conversations as well, just so you are maybe prepared, maybe looking at what alternatives there is, that could be a way to go about sort of like just modifying, some lifestyle changes. I mean,
Yeah.
medication is not really a lifestyle change, but it's just also something that I feel anyone should have a conversation with their doctor. So if you maybe I've read in your patient information leaflet that this drug could be causing certain issues, just have that conversation with your doctor and maybe see if there's any alternatives that you could possibly be on that could help at least sort some of these things out, basically.
Yeah.
Mm.
Fantastic. Fantastic. And I think there's one thing that I also wanted to touch on with some, let's say the younger generations,
Mm-hmm.
sometimes the erectile dysfunction may be caused by some of the drugs we take, like recreational drugs. And I
Mm-hmm.
think it's important we touch on that.
Yeah.
Like these people don't they don't recognize that the drugs that they may be taking is
Yeah.
actually what's causing them to have erectile dysfunction.
Yeah.
So by you not taking the recreational drugs, that would actually help improve your erectile dysfunction. So
Yeah.
please consider doing that. Yeah, because
Yeah.
that's what's probably causing it. Yeah.
Yeah.
Um. Fantastic. So Trudy, have you come across any bizarre questions that patients have asked you about
In
these medications?
Well, I mean, most of them is not bizarre anymore because it's almost like what
Yeah.
everyone asks. First of all, is how
Mm,
long is this going to last? Am I going to be able to last all
mm,
night? You know, and
yeah.
I mean, depending on what you're taking, but chances are no, you will not. That is not really the case, and.
Yeah.
And unfortunately, it is just something that should be used if you have erectile dysfunction. But if you want to last all night, maybe this is not really a medication for you, especially if you don't suffer from
Okay.
erectile dysfunction. But that is one thing I get asked a lot. Some of the patients
Mm,
actually, this is a suitable medication for them, but they still want to just know, like how long am I going to last? So that is one question
yeah.
that I get asked so often. Um,
Okay.
and also, another question is, who is going to know that I am buying Viagra Connect or,
Yeah.
Cialis? So, I mean, it is, as we said, it is a taboo topic. And also, you
Mm,
don't want people knowing what it is that you take, what it is that, you've gone to the pharmacy for.
that's
So a lot of
right.
people ask this because I want to know, first of all, this information I'm giving you, who else is going to have this information? Now, I'm not sure that's that's a great thing coming from someone buying that because if it's your wife knowing or your partner knowing, I mean, I don't see what is so wrong about that because, we should have these conversations and we should be honest about this conversation.
Yeah.
It shouldn't be something that is even embarrassing enough that you can't talk to your partner about or you can't talk to your wife about.
Okay.
It should be conversations that we can openly have. But sometimes maybe you're maybe using it elsewhere, which, we're not judging, we're only here to provide medication, but it is also still worth having these conversations. It shouldn't be anything, it shouldn't be an embarrassing topic. It shouldn't be even a taboo topic because erectile dysfunction is a condition just like any other condition. So if you need the
Mhm.
medication, it should be a conversation we can all have.
That's right. That's right. Fantastic. So, as we've mentioned, erectile dysfunction, it's a common thing that occurs
Very.
to men. Yeah. We've just talked about Viagra and Cialis, because they are like the common ones that people use, but there are other alternatives. We will touch on them later on, maybe during other episodes, or we will put that in Instagram. But there are other treatments for erectile dysfunction, which we will discuss. And if you have any questions on them, please do let us know.
Yes, certainly. Now, just very whilst we were talking about how it shouldn't be a taboo conversation or it shouldn't even be an embarrassing topic, it is something that we as pharmacists get into conversations about every day, all the time. A lot of people come in and they want to know about this. And studies have actually shown that actually a lot more men are suffering from erectile dysfunction. So it is not something that we should even be playing or joking around on. It is a serious
Mm.
it's a serious condition. Now the reason I
Yeah.
say that is a couple of times people have come into pharmacy, and two people so far have come in and they wanted to buy it, not for themselves. So one of them was a lady, and I was like, well, we cannot sell it to a lady. And she's like, no, it's not for
Mm.
me. I'm going to a wedding and I want to prank the groom. And I thought, this is not even, it shouldn't even be something we're pranking people on.
Oh
This is a
no.
serious thing for someone else. This is actually
Yeah.
something they have to live with. And then again, another man come in, and I think he was going to a bachelor party, and he was like, oh, I just want to go for the groom, just a little prank, or, get him all. No, first of
Oh,
all, if the groom doesn't need it, you're just pranking yourself because you're wasting your money, So
yeah.
it shouldn't be something that we joke about, because there is a lot of, there's a lot of that, people are like, oh yeah, you're on Viagra, you can't,
Yeah.
you come into an erection, it shouldn't even be that, because it is a serious condition. And some people, it's purely because of some of the medications that they're on and some of the conditions that they're suffering from, that they're having to take Viagra or sildenafil. So, Stephanie, whilst we're really talking about this, about Viagra and Cialis, I don't know if you've heard this, but I've had a question from a few of my patients where they've come in and they've asked, is there anything like a herbal Viagra Connect? What do you think about this? Like, have you heard this question?
Mm.
If you have, like, what have you said to patients?
Yeah. I think, yeah, there are loads of patients talking about these herbal Viagra Connect, herbal Cialis. There's been like loads of claims that there are things like that, but there is no such thing, guys. There is no such thing as a herbal Viagra or herbal Cialis. I've not heard of that. I've not come across that. There hasn't been any. I don't think, to be honest, I have not seen it. It has not been approved that these things can be used to be treated for erectile dysfunction. So I don't know where people are coming up with these things. Speaking of herbal, I think people need to be careful. Like with herbal treatments, it hasn't been tested like let's say, prescription medications, where they test whether it has interaction with these medications or it can be taken with these medications.
Yeah.
So people just need to be careful. If you are taking Viagra or Viagra Connect or Cialis, do check to see whether whatever herbal medications you're taking is okay with these medications. But as I said, there's not really like evidence there that
Mm-hmm.
have tested these things, and I have not heard a thing about herbal Cialis or herbal Viagra Connect. So yeah, there's so many things out there, honestly, guys. Just make sure that you get the right information from a credible source. Yeah.
Yeah, that is true. Because honestly, like the things that people come up with is, the list is endless. And yeah, Steph,
Yeah.
if it doesn't say Viagra Connect, if you're asking or it says it's a herbal Viagra Connect, it is not the right thing. Because it is, at least so far, as much as, we know, there isn't anything like Viagra Connect.
Yeah.
Now, another thing I've actually heard from a few patients is, well, they ask, after the 4 hours, what happens to the Viagra in my body? Like, is after 2 days, am I going to be erect, like all of a sudden? I don't know if you've heard that, or I don't even know if that is a
Yeah.
myth or it's just some sort of idea that maybe some people have. But what would you say about that?
Well, as far as I'm aware, with these medications, let's take the Viagra Connect, for instance, the sildenafil. It works up to 4 hours. So from what I know, after 4 hours, it's not going to be effective anymore.
Mm-hmm.
So you're not going to all of a sudden have like an erection later on, like in the
Yeah.
day or later on the next day or so. So I'm not sure about that, but I'll have to check. Maybe it does happen to some people, but as far as I'm aware, you know, so the drugs. have like a duration of time where they last for.
Mm-hmm.
So after that certain amount of time, that is it. It gets cleared out of your system and
Yeah.
it's not gonna work anymore. Yeah. So that's why some people like this sometimes they may say the Viagra has not worked. That's
Mm-hmm.
probably because maybe they've taken it at the wrong time. So
Mm-hmm.
they may have taken it outside the window or basically way too early or way too late. So they
Yeah.
probably didn't get the erection the time they needed. So
Yeah.
do watch, like, as we mentioned before, take it 30 to 60 minutes before
Mm-hmm.
like getting sexual intercourse, and
Yeah.
it will last up to like 4 hours when it comes to the Viagra Connect. With like the Cialis, it does last up to 36 hours. So
Yeah.
maybe that one, you may have that effect after like a day because that
Yeah.
has like a lasting effect. Yeah. If
Mm-hmm.
you are sexually aroused, you probably, yeah, and you probably can get erected like after a certain amount because that
Mm-hmm.
lasts for 36. So yes, that is, I don't know about the 4 hours window when it comes to Viagra. Yeah.
Yeah. Yeah, I mean, do you know what? Yeah, that is true, and it's one of those, because everyone is so different, and we're women, we don't know some of these answers. So,
Yeah.
if after 4 hours, something happens, let your doctors know. Maybe there's some research that needs to be
Yeah.
done out there. But yeah, what I also get is people come in and they say that, oh, I took more than one tablet by mistake. So basically within the sort of 24 hours, they say, oh yeah, I took one in the morning and then I didn't realize, and in the evening I did take another, or in the afternoon I took another. Like, what do you reckon they should do, Steph, in this case?
So, with the Viagra, it comes in different strengths.
Mm-hmm.
So we do have 50 and people can take higher strengths. So we do need to check like the strengths of it and see whether it has gone above the limit. When
Mm-hmm.
that happens, do monitor yourself, check to see if you're getting any side effects,
Yeah.
Are you getting really like maybe getting palpitation, getting really dizzy? If that's happening, please do sit down a little bit. If you're getting like really strange like side effects, obviously do go straight to A&E so that they will have
Mm-hmm.
a look at you. Always read the leaflet as well before you take a medication to see how much you should be taking of them. I mean, as we said, you could take Viagra and Cialis as often as you can, like you could take one every day. So, but you just need to check the strength of it as well, I would say. Yeah.
Yeah. Yeah.
Mhm.
One last myth that I have heard, and
Yeah.
do you know what? It's actually something I've heard a few times. And someone said something, and I thought,
Mhm.
wait, maybe some research needs to be done here. So a lot of people have got this impression that hot showers can actually
Mhm.
cause erectile dysfunction. And I actually heard
Okay.
this from a pharmacist who I think he had a child later on in life with his partner, and someone asked him like, what did you do? And he said, I stopped taking like hot showers or something like that. And I was like,
Okay.
was he being serious, or is this actually a thing?
Oh,
Is this something that is actually studied?
okay. Okay. I mean, I haven't come across it, but just using my knowledge here, I mean, heat can damage like a lot of things. So
Mm-hmm.
I guess heat can damage like the nerves and the penis.
Yeah.
So if you're someone that is having maybe like a regular hot shower, maybe
Mm-hmm. Hot
saunas, that sort
bath.
of thing,
Yeah.
yeah, it's possible,
It can.
because
Yeah.
let's face it, like if you're having it regularly, that is going to damage some things down below. So
Mm-hmm.
I guess you may have to reduce that hot showers, the saunas, you
Yeah.
know. But I don't know. I haven't really looked into it, but I was just using my knowledge. I would think so that the heat might damage like the nerves down there. Yeah.
Yeah.
So they do have some sort of say in that. Yeah.
To be honest, a hot shower is not really that good for the skin because it strips off all the good oils and all that. So maybe a warm bath,
Mm,
a hot shower, a warm shower is probably what is suitable. But I am glad we're all having these conversations. I'm glad that there's people asking about these kind of
yes.
topics.
Yes, yes, I agree. I agree. Guys, please do not be ashamed of these topics. If you
No.
have any more embarrassing topics you want to talk about,
Yeah.
please feel free to share it with us.
Yeah.
We are here to provide you with the answers, or if we don't know the answers, we will research about it and let you
Yeah.
know.
Definitely. Definitely.
Yeah.
Good. Thank you for tuning in today. We hope you enjoyed this episode. Remember, a healthy chat is a step towards a healthy life.
If you have any topics you'd like us to discuss, drop us an email at consultationroompod@gmail.com. Our Instagram is @consultationroompod. See you next week.